For decades, weight loss medicine meant fighting your own biology. Tirzepatide flips that. It works with two of your own gut hormones at once, and the clinical results have genuinely changed the field. In this video, I will walk you through exactly what Tirzepatide is, how it works at the biological level, the clinical evidence behind it, and I will address 4 of the most common myths surrounding it. This content comes from 20 Mile Medical, a board-certified telemedicine practice. We have an async first weight loss and metabolic health service line. I am Dr. James Ries. We believe patients deserve access to the same quality of information their doctors have. The gap between the research literature and what reaches the average person is enormous. And with a medication this widely discussed and misunderstood, that gap matters. Disclaimer, everything here is educational only. This is not medical advice. Work with a licensed provider. Link in the description to connect with our team at 20 Mile Medical. Tirzepatide is a once-weekly injectable, and it is the first of its kind, a dual GIP and GLP-1 receptor agonist. GIP and GLP-1 are incretin hormones your own gut releases after you eat. Tirzepatide is a single molecule engineered to activate both receptors at the same time. It reduces appetite, slows gastric emptying, improves insulin response, and lowers blood sugar. It is FDA approved as Mounjaro for type 2 diabetes and as Zepbound for chronic weight management. Unlike older weight loss approaches that fought the body's hunger signaling, Tirzepatide works with the body's own metabolic machinery, which is a large part of why the results have been so striking. First, appetite and satiety. Tirzepatide acts on the GLP-1 receptor, signaling the brain that you are full. It turns down both appetite and the persistent food noise many patients describe. The result is that eating less stops feeling like a constant fight. Second, the GIP advantage. The GIP receptor is what sets Tirzepatide apart from GLP-1 only drugs. It appears to enhance insulin sensitivity and improve how the body stores and uses fat and energy. Researchers believe the GIP component is a major reason Tirzepatide has outperformed single pathway drugs. And third, slowed gastric emptying. Tirzepatide slows the rate at which the stomach empties. Food stays present longer, so you feel full sooner and stay full for hours. This same effect is why most side effects are digestive and why we titrate the dose up slowly to let the body adapt. Fourth, cardiometabolic effects. The benefits reach well beyond the scale. In clinical trials, patients saw meaningful improvements in A1C, blood pressure, and cholesterol. For many people, this is the part that matters most for long-term health. Tirzepatide is metabolic medicine. How does Tirzepatide compare to GLP-1 only drugs like semaglutide, Ozempic, and Wegovy? Semaglutide activates one receptor, GLP-1. Tirzepatide activates 2, GIP and GLP-1. In the SURMOUNT and SURPASS trial programs, the dual mechanism produced greater average weight loss. They are related but not interchangeable. The right choice depends on the individual patient and their goals. Clinical applications include chronic weight management and type 2 diabetes, also insulin resistance, cardiometabolic risk reduction, and obstructive sleep apnea. The medication works best as part of a structured plan, combined with nutrition, protein, and movement. Myth 1, it's just the easy way out. Reality, Tirzepatide corrects the hormonal signaling of metabolic disease. It works best paired with protein, resistance training, and sustainable habits. Myth 2, you just lose all your muscle. Reality, the mitigation is well established. Prioritize protein and resistance training. Myth 3, you gain it all back. Reality, obesity is a chronic condition. Dosing manages ongoing physiology. Myth 4, it's the same as Ozempic. Reality, Tirzepatide is a dual agonist, producing greater results in head-to-head data. Is it FDA approved? Yes, as Mounjaro for type 2 diabetes and Zepbound for chronic weight management. How quickly does it work? Appetite changes appear within weeks. Weight loss builds over months as the dose is titrated. Who is a good candidate? We evaluate BMI criteria, metabolic conditions, and any contraindications. What about side effects? Mostly digestive, like nausea or fullness, usually improving with slow titration. Tirzepatide isn't a shortcut. It's a dual hormone tool with the strongest evidence we've ever had. If you want to explore this, 20 Mile Medical offers async first telemedicine weight loss care. Subscribe for more. Drop your questions below. I am Dr. James Ries. I will see you in the next one.